Hello, today I'm going to be talking to you about non-ST elevation myocardial infarctions, otherwise on nursing units known as NSTEMIs. This is going to be exactly what it sounds like. It's a heart attack without ST elevations on the monitor. Okay, so here at the top, we have a strip of normal sinus rhythm just to be compared. So on our right is an actual strip of an NSTEMI where you can see that ST depression. And that can be compared to a normal STEMI that has that ST elevation that you can see. So now we're going to talk about common signs, symptoms, and risk factors for NSTEMIs. Some of the common signs include shortness of breath, chest pain. That pain can also radiate down the left arm into the jaw, the neck, back, or stomach. We have lightheadedness and dizziness, nausea, sweating, and fatigue added in there as well. Some of the risk factors that are involved in myocardial infarctions, whether they're STEMI or non-STEMIs, include smoking, being physically inactive, hypertension, uncontrolled diabetes, being overweight, and a family history or patient history of heart disease and or stroke. Being on CVSU, I've actually had multiple patients with NSTEMIs. This specific patient was one that I had most recently. He was a 67-year-old male. He came into the emergency department with complaints of shortness of breath and chest pain. 2 nitroglycerin tabs were administered sublingual. Blood labs were drawn, and a 12-lead EKG was obtained. And that's how he got the diagnosis of an NSTEMI. The patient had a history of hypertension, diabetes, currently smoked, and was overweight. After the patient stabilized, he was transferred to CVSU. After getting our patient to the unit, we set up a goal for our patient, and that main goal that we had was for this patient to remain chest pain free throughout our 12-hour shift. To do this, we used different nursing interventions, the first one being a head-to-toe assessment. Here we focused on the gas exchange due to the shortness of breath the patient had experienced and perfusion for obvious reasons. We had vitals taken and an EKG obtained. Both of these are like a standard set order on our floor. Everyone that gets admitted has to get these. We also did medication education for our patient, and then we educated our patient on the importance of smoking cessation, controlling his diabetes and his diet, and maintaining a good weight. We did end up meeting this goal because the patient did remain chest pain free for the remainder of our shift. Now I'm going to be talking about the algorithm that I or a nurse on the unit would use if we were to get a patient admitted with an NSTEMI. Here we're going to start out as the patient being admitted from the emergency department with that diagnosis. Okay, just to explain a little, any questions that are going to be asked are going to be in a red box. The answers are going to be in purple. And then we have the blue and the green boxes, and those go together as the algorithm goes down. So the first question that we're going to be asking is that patient currently symptomatic? If the answer is yes, the first things that we're going to be doing are getting vitals, getting a 12-lead EKG, setting up our telemetry monitor, calling the doctors for orders that could include oxygen, a cardiac panel, a nitroglycerin order, aspirin, morphine. Those are actually considered MONAs. It's just a short little thing that we're able to say on the floor. We'll be doing old carts to figure out the pain, and then we're also going to make sure that we maintain that IV access so that we are able to use it if needed. Now, if the patient is not symptomatic, we head over to that green box. And because it's a standard order on our unit, no matter what, they're still going to be getting a vitals, the 12-lead EKG. They will be hooked up to the telemetry monitor, and we'll most likely be calling the doctor to have orders set up. They'll most likely order a stress test, a CT, an MRI, or an angiogram, depending on what they prefer. Okay, and to continue on, say we answered yes to this patient being currently symptomatic. After we do all those first steps, the next thing that we're going to be asking is, does this patient need to go to the cath lab? If the answer is yes for that, we'll go to that next blue box. We'll be obtaining the consent, getting pre-procedure orders, which could include a loading dose of an antiplatelet, and possibly even a heparin drip. So whether we answered yes to the patient being symptomatic or no, depending on whether they need to go to the cath lab, we'll be going to that next green box. Most likely this patient has stable angina, and that means that the chest pain goes away with a nitroglycerin, sublingual tab, and rest. Therefore, the patient really doesn't need to go to the cath lab, and no interventions should be done. After the cath lab, or after we've figured out it's stable angina, we are going to be educating the patient on smoking cessation, controlling their diabetes, a heart-healthy diet, making sure they're exercising, and then most importantly, we're going to be educating them on their medications, what they're taking, why they're taking it, and how important it is for them to be taking it consistently and on schedule. This is just a page with a list of references that I used to complete this assignment. This is just a page with a list of references that I used to complete this assignment. This is just a page with a list of references that I used to complete